Well, good morning, and welcome to the Hangar, which is Toronto's latest and our sixth city-run vaccine clinic to open, and it's opening today, officially at 11 o'clock. Appointments are booked, but there are still appointments that are available, but you need to have an appointment in order to come here. And for those who don't know where the Hangar is, it is not surprisingly in Downsview Park, which was formerly an airport, hence you have a hangar here, but you can see it's all set up and ready to receive people this morning, many hundreds and thousands of people over the coming days. We have seen how successful our vaccination clinics have been in our effort to vaccinate as many residents as quickly as we possibly can. The opening of this new clinic is another step forward in our Team Toronto effort to vaccinate as many residents of the city as possible as soon as we can. The numbers are climbing, slowly but surely, and we're trying to speed that up by having more clinics and getting more people to book appointments. So far, and that's not including the very latest numbers, but right up to date, to pretty much we have administered 595,204 doses in Toronto. And that's between our city clinics and between the hospital clinics and between the pharmacists and different healthcare partners who are doing many things in the community. And lest you think that it is just confined to these bigger vaccine clinics, in fact, on this day, there are 17 different kinds of clinics operating across the city, all of them doing very important work in getting people vaccinated who have come forward to be vaccinated. But that's one of the keys, isn't it? You have to be available and ideally come forward to either book an appointment or to present yourself at one of these clinics that may be happening more locally in order to get vaccinated. So the Hangar's ready to open today, and that will take, with the current supply of vaccine from the other governments, that will take the city-run clinics to the point where they can vaccinate 8,100 people each day and 56,000 plus people each week. So these are significant numbers, but again, they rely on you coming forward in the case of these city-run clinics and making an appointment either online or by telephone. And I'm told that that system has performed really well. It's a system put in place by the Government of Ontario, and that people find it either online or on the phone relatively easy to use. I'm urging people to get registered and to get their vaccine if they're eligible. And as you know, various changes have been made over time in different settings by the hospitals and by ourselves. So for these city-run clinics now, if you are age 60 or over, you can book an appointment. You could go online right now and book an appointment for almost any day going forward, because while they're filling up, we do have some availabilities for people, and it's very simple to do. You need your health card, your date of birth, an email address, or a phone number, and I think that's basically it. And people have reported that it's very easy to use. So I think if I had one message today for people on behalf of my colleagues, and I failed to introduce them, I apologize. I have a large number of colleagues here today, but I have Dr. Eileen de Villa, who you know well as our Medical Officer of Health, who's done such a superb job helping to guide us through this whole experience. That's a good word for it, isn't it? An experience. There'd be other words you could use, but on the medical side, we have Chief Matthew Pegg, who is looking after, I'll call it the logistical side of actually getting a lot of this done with a lot of good help, including Commander Wozniak from the Emergency Services, who's kind of on loan like a lot of people are. And then there are elected representatives who join me here today, the local councillor, James Pasternak, who is here, Councillor Joe Cressy, who is the chair of the Board of Health and who's been steadfast in helping us put all of this together, working alongside Dr. de Villa, Chief Pegg, and everybody else. And last but certainly not least, Yara Sachs, who is the federal member of Parliament for this area in the northwest part of the city. So how to book? And again, we can't repeat this often enough. We try to have signs available. We try to, I think I'll probably soon start to wear a sign on my back that sort of indicates how to do it, because we just need people to remember the email address and or remember the phone number. But in the case of the URL, the place where you go on the internet, it's toronto.ca/COVID-19. And there's a big button there that you just push saying, yes, I want to go and get an appointment made for vaccination. And the phone number, which I now repeat so often that I remember it in my head, is 1-888-999-6488. That's 1-888-999-6488. And they have hundreds and hundreds of people there to take your call and to answer some questions if you have them, but most of all, to get you registered. If you're 55 years of age and older, I mentioned these clinics are at the present time for people 60 years and older, and we've had many 60-plus people sign up in the last few days, tens of thousands, and it's been fantastic, and I thank you. If you're 55 and older, you can get your vaccine at a pharmacy across the city, and the province just expanded the successful program. Again, I'm on some of the pharmacy waiting lists, and it's relatively easy to register. You go to the Rexall, and then there are buttons to push and very simple information to put in. Same with Shoppers Drug Mart and others. And I hope people will take advantage of all of those different opportunities, in addition to some of the clinics being offered by some of our healthcare and hospital partners, which you will know about in your local communities. I also put out a plea to those who are friends of, relatives of those who are in the eligible groups. Some people have more trouble, either because they have more trouble with the technology, or others just have maybe a bit of hesitation about getting vaccinated. And if you know people that are in those categories but are eligible, we would urge you to please reach out to them and help them, encourage them to get vaccinated, encourage them to understand it is completely safe. Dr. de Villa would tell you that. Any vaccine is a good vaccine. They're all going to be helpful in providing you and your family and your coworkers and your friends with protection. And then maybe you could help them in some way or other to get vaccinated, whether it's a ride. We have some services that are trying to be helpful with that, but if you can help, so much the better. We can all play a role in getting people vaccinated. And you know what? We have two weapons, as I would say, in the fight against COVID-19 and the variants. The first weapon, and the one we've always had, is the one that says if you follow public health guidance, this dramatically reduces the chance of you becoming infected or you infecting someone else if by chance you don't have any symptoms but you're carrying this virus. And that is staying home as much as possible, not socializing with people you don't live with, wearing a mask, washing your hands, avoiding crowd scenes. These are the things we know that we've talked about for so long now, way too long. And then the second is to get vaccinated. You know, we have all kinds of indicators from other countries, but even from right here. When elderly people in long-term care got vaccinated, which was properly treated as a top priority by the provincial government in setting the priority list, we found that the rate of infection in those long-term care residences among our most elderly, frail people dropped down to literally a handful of cases because everybody was vaccinated. So a couple other things to keep in mind as you book. You don't have to come here a couple of hours early. I'm a bit that way about airports, to be honest, and I sort of arrive way ahead of when I have to. It's not a bad thing, but here it can cause some problems just because they're processing people by time, you know, and so if you're showing up really early, you're ahead of somebody potentially in the line who has their appointment maybe 15 minutes later. So we're just suggesting people not come too early and arrive as close to your appointment time as possible to avoid a sort of a crowd situation and avoid for you having to wait and stand around as well, which in some cases is more difficult than others. All of the sites are accessible and have accessibility entrances, and so I think there's now good signage. We learned from that in the first few days if you need to take advantage of that particular entrance or exit in order to be comfortable. So I want to finally say two more things. First of all, I want to thank our city staff and all the staff, because when I say city staff, we have here emergency response workers from all different areas, police officers, firefighters, EMS, paramedics, and then we have city staff come from Toronto Public Health and elsewhere. We have registered nurses who have RPNs who've come to help us on this assignment in particular, who didn't necessarily work for the city, but they form a fantastic team of people who make these clinics work. And every review I've heard, almost without exception, from many, many people who email my office, which you should feel free to do, by the way, at mayor_tory@toronto.ca, but they say the experience has been a good one. I got several emails just yesterday saying what a great, professional, competent, comfortable experience it was, and that's the way we set out to make it, thanks to the hard work of Chief Pegg and his team. I want you to know that we are working right now on plans to take vaccinations out to places where it might be a little harder for people to get themselves to one of these clinics, or where there is just higher risk and where some of these qualifications we're using at the moment that say are based more on age are able to be taken into account. And as you might expect, given things like vaccine shipment and having teams ready to go out to given places and finding ways to register those people, this is not a simple task, but we're hard at work on it. And the objective is to have, as soon as possible, a supplement, because we have had all the way through mobile clinics going into different buildings that house seniors centres and going into different places, but we hope to be able to take it to workplaces, for example, where we know there's a higher risk just given all of the circumstances, and to other areas where we know people are more vulnerable. And so we're working very hard on plans to do that. And then the second message I would have to you is there's a lot of stuff being put in the news and in social media. And again, I certainly don't offer medical advice. Dr. de Villa knows I shy away from that, but I have listened to her, and I've listened to many other people who will say that every vaccine that is administered, every single one, doesn't matter how old you are or who you are or what your occupation is, and every vaccine that is used in the course of those vaccinations, these are good vaccinations because they're going to help us in what I call the war effort to get us to the point where we can get back to a more normal life and have a summer. And I know having a summer sounds like it's something that's fairly trite, but I think you know what I mean. It isn't just about the weather, and it isn't just about patios, and it isn't just about parks. It's that feeling we all have, I think, in the summer where we feel relaxed and we feel good about life in this country that has 4 wonderful seasons. And summer is maybe the one that a lot of people would say is their favorite. And I just think we want to get back to having a summer, which means in a very few months' time we can be back to something much closer to a normal life. The local councillor, James Pasternak, had asked that he might just say a few words, which he will do now, and then we will be happy if there are some questions to answer those in just 1 minute.
We're good? Okay. Thank you so much, Chief Medical Officer de Villa, Dr. de Villa, Mayor Tory, of course, Chief Pegg, local MP Sachs, and of course, my colleague, Councillor Joe Cressy. It is great to see this team here in Downsview. And I can tell you these lands represent a strong history, a great history in protecting Canadians through World War, through aviation and aeronautics, through the military, keeping our country safe and preserving peace. And we are writing a new history today where we are running a mass vaccination site to keep the people of Downsview and beyond safe. And I just want to thank all the volunteers, an army of volunteers and medical people, frontline medical staff, doctors and nurses who are here today to make this happen. And it's been a rough year, but this is certainly inspiring. And to have it in our local community is a great honor. So when your age comes up, I urge everybody to get a vaccine. It is the way to be safe for the present and the future. And I just want to thank once again all the volunteers and medical people, fire services and EMS, and of course my colleague here, Joe Cressy, and my counterpart, MP Sachs, and of course Mayor Tory, for all their great work in making Torontonians safe. Thank you very much.
Thank you, Councillor. Does that sound gone again? Is it okay? Thank you, Councillor. Are there any questions you have? Well, we're hard at work on this now, and either Chief Pegg or Dr. de Villa can talk to you, but I can just say to you that when we talk about a retooling, maybe it's a way to sort of take us to the next phase and to making sure that we use even more resources to get even more people vaccinated, and that involves some of what I referred to earlier. It involves going out wherever we can to workplaces that are at higher risk and vaccinating on the spot, so that then it's much easier for people to get vaccinated in a place where they're much more likely to contract the virus. It involves what we're already doing, going to neighborhoods, but in increased numbers, in neighborhoods where there is an increased area or element of risk involved with regard to the vaccines. It involves a whole host of things like that, many of which we've already started to do, but it just means deploying even more resources, given, if we're honest about this, the fact that people have been responding, but not perhaps in the numbers that we might have expected to come to these vaccine clinics. They are responding. The response rate for next week is good, but we need to go out to some of the areas that are more at risk. And that is dependent, of course, on supply. And I should make that point because we've been in constant discussion with the other governments about supply, which is a constant I'll call it a concern. And then secondly, it relies on us being able to continue to work well with which we've done with the province to make sure that we can easily register people and work with our healthcare partners. So there are lots of discussions going on across the board with healthcare partners, with hospitals, with the other governments to make sure we can reach out to the people who are most vulnerable, that we can move forward with the phases that have been put in place by the province to deal with essential workers, and at the same time have the mass of the public who are in age groups 60, 70, 80 who have not yet signed up to get vaccinated, and that's a lot of what these clinics were meant to do. Does anybody want to add to that in terms of what we're doing? Pardon me? Okay. Well, I will speak for myself on this and then ask if our medical officer of health wants to say a word. But I will say this. If sick days time hadn't come, paid sick days time hadn't come before this, which I believe they had, and we said that as individual mayors and as groups of mayors, then the time has certainly come now. When we're in the third wave, it is one that is taking an even worse toll, it would seem, in terms of ICU occupancy and hospital overload and this kind of thing. And we have asked as mayors that something be done during the course of the pandemic. So for those who want to have a big policy debate, that's not the issue here. The issue is just like all of the other emergency measures that have been taken to make sure people could not have the slightest reason, especially financial, to stay home when they're sick or when they test positive, or even a fear of getting tested for fear they might miss work and miss a paycheck, that we eliminate that. And I know that the governments have made some, especially the federal government has made some effort in this regard, but I would say, based on what we see happening, it's still not enough. And if they could get together as governments, the federal and the provincial governments, and do something more that would allow these people to have the assurance during the pandemic that they will not miss a paycheck because they get sick, I think that goes along the kind of thinking that most Canadians would have, that people shouldn't be afraid of treating themselves properly, getting tested, getting vaccinated, staying home when they're sick because of the fear of missing a paycheck. And so I just hope that that is given some degree of reconsideration, because I think right now we have a very serious challenge on our hands, and we need to have everything done that is going to make people feel comfortable in getting vaccinated. And I think the time has come if it wasn't already here before.
Having mask issues here. There we go. So I think the mayor has already spoken quite well on the subject of paid sick leave and why it's such an important component of the pandemic response. We certainly want people to have the ability to be able to stay home when they're feeling unwell or when they think they might be sick, so as to prevent the spread of infection, but to do so in a way that they're no longer afraid of losing important income or having to sacrifice the welfare of their family in order to do the right action in terms of protecting people from COVID-19. The question also asked about vaccine as well. And as I see it, this is not an either-or thing. It's actually a both-and. We need both the protections for workers for paid sick leave so that they can take the right action when they feel unwell without having to worry for their family's welfare. And of course, we need vaccine. I think the important part about vaccine that we all need to understand is that it is an absolutely important strategy, but it is one that has its greatest effects. It has its fulsome benefit weeks down the road. So the ability to stay home from work when you're sick is a today strategy. Vaccine is a strategy that protects better for tomorrow and will prevent future waves of infection and therefore protect not only the person who receives the vaccine, but all those around them and the whole community as a result. So there's no question. The case counts are, horrific. They're not what we want to see. They are going absolutely in the wrong direction. I would say this. We have been in the pandemic now and in pandemic response for many months now, and we've had the opportunity to observe what measures actually work in terms of reducing infection. We've seen the opportunity for those measures to work here. We've seen what measures work overseas, and we've had opportunities to witness this on several occasions now. there's no question that measures that promote distance, whether taken at a policy level or taken by us as individuals, will help reduce transmission, and importantly, not only will they help reduce transmission, they will also allow for vaccines to have their greatest capacity, their greatest effect in terms of protecting all of us. So these are the important lessons that we've learned over the course of the pandemic. I continue to champion those important lessons at every table where I have that opportunity. And of course, I would encourage people to continue to follow the measures for self-protection. Distance does make a difference. What they do at an individual level absolutely makes a difference. And of course, finally, I would remind people that as their turn comes up for vaccine, this is one of the most important tools that we have in our toolkit right now to protect each of ourselves as individuals and to protect those around us. I'll turn it over to the Mayor.
Can I just add one more thing on the subject of, pardon me, of paid sick days? A very interesting study has just come out from Israel. And it shows, not surprisingly to any of us that have been advocating on this during the pandemic to do an emergency measure that is even stronger than the one the federal government has done, that when people have paid sick days, 94% of them comply with public health guidance to stay home and to isolate and so on. Whereas when they don't have paid sick days, just over half do. So that you've got a big margin of people there, and it's not their fault. Nobody should blame them. They're terrified about losing the source of livelihood for their family, their paycheck, and being able to feed their family. So when they have paid sick days, they stay home and they stay isolated. When they don't have them, many don't, because they're afraid of the consequences of not going to work and maybe losing their job or certainly losing their paycheck. So it's just interesting to see in a place like that where they've had considerable success dealing with the COVID-19 virus that that is the result of the policies enacted there to help people to do the right thing. With respect to further restrictions, I would only say this. I said from the beginning last week when this latest round of restrictions was announced that I was willing, as one mayor of the biggest city in the province and in the country, alongside, I know, my colleagues, to sit down and have a discussion about what more might need to be done in order to wrestle this to the ground. I think we have to sit down and have that discussion now. I think we need to have it in a very open and honest way without any fear of the criticism that can come, because no matter what you do in trying to find the right thing to do when there is no right or wrong answer, there's going to be some criticism of it. But the fact is, people around the world are searching for the right thing to do, and looking at additional things we could do in workplaces, in the community, I think has been proven more often than not to be as successful as anything else, in addition to keeping distance and wearing masks, as anything we know about. If there was a magic solution, we would have adopted it by now. And the vaccines are the closest thing to magic. They're science, and we need people to get vaccinated. But as Dr. de Villa said, in the meantime, we have to do as much as possible to keep people separate and apart from each other, to keep that distance and to avoid really risky situations where people are more likely to come in contact with each other. So I'm open to that discussion. I've said that from minute number one of this current round, and I just think you can never go wrong doing the right thing. As much as it may seem painful to do it, as much as it inflicts pain on some people, which we all feel terribly sorry about, but in the end, I think we'll be a lot better off if we act now and we bring this to an end and we have a healthy people, we have a healthy economy back, we have our summer back, which is one of those things that people can look forward to, because, you know, we're not that far away, even though things seem bad at the moment, if we just do the right thing to get the rest of the way there. We're actually not meeting today. We'll be meeting because of the it's a government holiday of sorts today, so we'll be meeting tomorrow. Thank you.